Hi, Rob. Hi, Jen. How are you guys doing today?
Good.
Excellent. Thank you so much for taking time out of your really busy schedule. I understand that right now things are just absolutely insane for you guys with the flu and all of the confusion, and we at Waldorf County General Hospital has gotten so many questions from community members, so we really appreciate you guys coming and sitting down and talking to us about the flu and H1N1, and hopefully we can get some of this confusion worked out. And also I want to make sure everyone knows that there is a flu hotline, and so this information is up to date as of right now, but it changes every second. So if you have additional questions, make sure you check the hotline. So, Rob, thanks again. The big question is, what's the difference between the seasonal flu and the swine flu? I mean, it just seems like we should know
I would say
that.
that's probably the biggest question that we probably get almost every day, is what's the difference between the two. There's still a lot of confusion out there. Some people with seasonal flu questions, some people with H1N1 swine flu questions, and so we get that question a lot. I would say the easiest way to answer that is the H1N1 is a young child and healthy person's disease.
Okay.
Typically the seasonal flu affects the elderly and older population, and so on a yearly basis during the calendar year, especially flu season, late fall to early winter, sometimes through the spring, we see a lot of elderly people getting the seasonal flu. This year we've got the new virus, the swine flu, and it's affecting younger populations, otherwise healthy. The population right now is probably between the ages of 4 and 25 is where the peak number of cases that we're seeing. That age group is being mostly affected.
Excellent. Can probably you, Rob, give me a pretty, concise but definition of what people can expect if they have the swine flu? How do they know? Or the seasonal flu? What are the symptoms, I guess? What should they be watching out for?
They're pretty similar actually to the seasonal flu, and I would say the majority of the cases are still presenting with fever, sore throat, cough, and that's sort of what we call ILI, or influenza-like illness. If you've got a fever greater than 100 degrees with a cough and or a sore throat, chances are pretty much you've got the swine flu or H1N1.
All right, and we're just going to talk a little bit more about symptoms and stuff, and then we'll go on to prevention, if that's all right with you guys. When does someone go to the doctor? How do they know that this is now the time? And we're hearing about people dying, and how do they know that they should go to their doctor or the emergency room?
Well, one of the things that the Maine Center for Disease Control and Prevention really wants to emphasize is that not everyone needs to be seen at a hospital for H1N1 or swine flu. And the best piece of advice that we give to people is call your healthcare provider. Don't run to their office. Don't run to the emergency room. In most cases, this is what is considered a mild illness. It's a fever, a sore throat, a cough. And checking in with your healthcare provider is a good thing to do. There are certain things that, especially in young kids and people with chronic illness, that you need to look for other signs for some possible complications like shortness of breath. And that's when you really need to be in contact with your healthcare provider. So in doubt, call your healthcare provider, but we definitely don't encourage people to go immediately to the emergency room or to their healthcare provider's office, since most of the guidance you're going to get from your healthcare provider is stay home, rest, drink, stay hydrated, and don't rush to the emergency room.
Excellent.
I think that last piece is probably the most important, is not to rush into the emergency room and then not to call the emergency room, because really the nurses who do the triage on the phone at the emergency room aren't really allowed to give advice over the phone. So if you call your primary care provider, they can actually help you and give you advice on what medicines to take or what to avoid. But the ER nurses are really going to be trained to say, if you think this is a medical emergency, come to the emergency room, otherwise call your provider.
All right,
That's the line
excellent.
you're
So
gonna
save a step along the way and call your healthcare provider first,
Definitely.
and know that they know the questions to ask you, and if there's a red flag for them, they're going to say, all right, get to the ER. Excellent. Now, on to the other really, really confusing topic, vaccination. Seasonal flu shot, H1N1 shot, missed. My daughter has asthma, so no missed, yes shot, 1 shot, 2 shot. How do you know? Can you just kind of give us a layman's overview of what exactly you know what to do?
Yeah, do you want to start?
Probably the simplest answer is get both.
Okay.
Get both the seasonal flu shot and the H1N1 shot. Neither one protects for the other. If you get a seasonal flu shot, it does not protect you for H1N1. If you get the H1N1 vaccine, it does not protect you against seasonal.
Okay.
And you really do need to get both vaccines. And right now, because there's just a little bit of vaccine coming into the state at a time, we're really focusing it on populations that are most at risk for complications. And as Rob had mentioned, that really is a younger population, between 6 months and 24 years. We also look at pregnant women who are also at risk. We also are looking to vaccinate as a higher priority are those people who live in households of children under less than 6 months, because children under less than 6 months cannot get vaccinated. So you protect those people around them.
Okay.
And hopefully the plan is that there'll be enough vaccine to offer to anyone in the state of Maine. But as we're slowly receiving it in the state right now, we're really focusing on certain populations.
All right, so everyone in the whole state should get the seasonal, and the top priority people should get the H1N1. Will your healthcare provider know the answer to that question too, if you call, and they'll be able to give you some guidance?
Definitely.
Or the hotline?
The other resource that I would mention is www.maineflu.gov.
Okay.
That is the Maine CDC's website, and it has a plethora of information for everyone,
Excellent.
as well as you can, from that webpage, email the Maine Center for Disease Control with your questions as well.
Excellent, and that's right at the bottom of the screen, so that's
Right.
very helpful. Thank you. And now we're almost out of time, and but I wanted to ask one more really important question. Besides getting the shot, what else can you do? What else can everybody do to help prevent themselves from getting sick? I know washing your hands, but what else
I
is
was gonna
there?
say, as you know, an infection control nurse, one of the most important things we preach all the time is hand hygiene. If you're out in the community, if you're out, walking around and whatnot, out in your healthcare provider's office, hand hygiene, hand hygiene, hand hygiene. Eating well is super important. Taking care of your body, exercising, and of course, staying away from sick people. If your kids are sick, then keeping them home from school. If you're sick yourself, then making sure that you're not returning to work until you're feeling better, so that we don't spread the flu.
All right, and one more quick question. Hand sanitizer, soap and water, doesn't matter.
If your hands are physically dirty, we often recommend that you wash your hands with soap and water, but if your hands aren't physically dirty, the hand sanitizer will kill the flu.
Excellent. Thank you guys
Okay,
so
thank you.
much. Have a great day, and you'll get through this just like the rest of us. I know
Thank you.
will.
Thank
Thank
you.
you.